Hi, I'm Bailey Rubin King, and I'm coming to you from All About You. And today I'm going to talk about the EHR system that we're going to be getting in our facility. So, with this new EHR, we will be able to speak to text your information in regarding your patient's history and medical records. You will be able to have access to all your lab results, your x-ray imaging, no more having to figure out what the doctor's writing by hand. Everything will be done by e-prescriptions, so there will be no more medical errors hopefully in the future. You can do scheduling, add and delete, reschedule your patients. It also has mobile apps for the patient to send the physician comments or questions about their medical or medications they're taking. With this new system that we will be receiving, if EMS is bringing in a patient and their EKG is showing that they need to go to the cath lab, they can send it directly over to our doctors and cath lab will be notified, so the patient will not have a wait time from door to cath lab. Our new system will also be able to have what is called the eye in the sky, where if a patient is trying to get out of the bed, it redirects them to stay in their bed. And if they continue, then that eye in the sky will notify the nurse or nurse's assistant to go in the room and help redirect the patient. Our new system will also offer the 12-lead EKG heart monitoring while the patient is out and about doing their daily activities. So the doctor is able to get real-time readings of what their heart is doing. The system will also notify patients of any smoking cessation classes that they've signed up for, the times that they are, where the locations are going to be at. The patients can also go on their mobile app and look at nutrition suggestions for if they're on any special diets, any type of medications that's requiring special diets. This new system has what is called the clinical image capture, where if a patient has a rash or a wound, they can take a picture of it with their mobile cell phone and send the picture immediately to their doctor for diagnosing, or if they need to come into the ER immediately. This new system also has what is called hands-free, so patients are able just to talk into their mobile instead of having to text a long question or email to the provider. This system will work for both iPhones, iOS, or Android systems, so it doesn't matter what cell phone type the patient has or what type the physician may carry. This system will also work on desktops, laptops, tablets, and smartphones. This new EHR can also help with organization to offer better health care and reduce the wait times in our offices. With this improved scheduling, patients don't have to sit for hours at a time waiting to see their doctor. This system will also help with education for when a patient is discharged. The nurse will be able to print out, like if they got a flu shot, the information on the flu shot, or if it's a pneumonia shot, what kind of reaction stuff to look for, or if they need to come back into the ER. This system will also improve with diagnostics, with the CT scans. If a patient is transferred to our facility, they are able to look up the CT scans from other hospitals to see if the patient needs any surgical interventions at that time. One of the main benefits of this new system that we'll be receiving is it will increase patient satisfaction. The EHR can help you organize, offer better health care, and improve communication with the patients and reduce the turnaround time and responds to billing and clinical inquiries. The billing part is very important to the hospital, as it will help the nurses bill as they go for the equipment they've used, doctors to bill the time that they spent with the patients or equipment that they've used in the OR. This system will help reduce double billing, upcoding, the lack of possibly forgetting to charge a patient. As the CEO, I encourage you to take the opportunity to take all the training seminars that we will be offering for this new system. I know no one likes to be forced into changing the routine, especially if they've been working with the current system that we have now. We're gonna try to make the transition as smooth as possible. My door is always open to, if you have any questions. We will be having super users to help walk everyone through this new system. We encourage the feedback from everyone as we are able to build new flow sheets, take things off, add parameters that you would like to see as your charting is going. As I wrap up my speech, I would like to talk a little bit more about the mobile app. I really encourage my staff to push this mobile app for their patients. It's the patient portal app that they will have to download on their phones. This portal app lets them make their appointments, see their current medication list, their dosages that they should be taking, how often they should be taking it. It has the email clients where they can email directly to their physician. It has their billing statements on there. This will have easy communication between the patient and the physician. I've encouraged my staff to please help your elderly patients get this downloaded. Go over it with the family members so everybody understands how to use this portal. Again, I want to thank you for listening to my speech on the EHR system. Hopefully this system will help retain our patients and they find that our system is more helpful to them. They want to stay with our system instead of going to a different facility system. Again, if you have any questions, we will have training seminars, we will have quarterly updates, we will have flash ads on our intranet systems. You can always email me if you have any questions, and we'll be sending out an email with all the super users information so you can ask them any questions.